welcome to the live podcast recording of the Rofi Collective. Today, we are going to be talking about fibroids. We are going to be talking about fibroids. My name is Larissa Assam, and by the grace and the mercies of God, I am a board certified family medicine physician, and I'm also the founder of Rofi, which is a platform that educates women on how they can prevent complications in pregnancy. Beyond that, we do a lot of education on women's health topics, such as the one we're going to discuss today, fibroids. So, welcome, welcome, welcome. Please share this with at least 10 people you know. With at least 10 people you know. So, we will get started. Okay, good. We are connected on all platforms. So, let's get right into it. Okay. So, we are talking about fibroids today. Have you heard about fibroids? Is this something that you've dealt with? Do you know anyone who struggles with fibroids? Let me know. Is this something that runs in your family? Let's discuss, because I find that I think it's always good to make sure you're talking about something and it's relevant, right? So I also like to gauge to see what our current understanding is of all of these different topics that we are always discussing. While waiting for you to respond, today I was thinking, this is a sidebar, I was thinking of the fact that one of the frequent questions I get is people often ask what they can do when they're on the road, when they're traveling frequently, where they can go to get something to eat. So today I had a pretty busy day and I ended up going to Kava. I'll post a reel about it probably tomorrow. But one of the things you can do is if you're on the go, you can look into getting Kava. Another option is sweet green. What I usually do when I go is I'll literally just get all the vegetables they have that I like, literally all of them. I don't really get the rice because for me it's a bit too heavy. Even though it's quote unquote brown rice, and maybe we need to have a discussion about the different types of rice that exist. But this is not sponsored, they didn't ask me, but this is a question I get asked all the time. Healthy places where people can go to get food, especially when they're traveling, especially when they're on the go. So please know that Kava is an option for you. So let's talk about fibroids. This is one of the most common gynecologic problems that affects women. And actually, a lot of women are dealing with fibroids and they really have no idea. They really don't know, and they sometimes actually don't get the care that they should get. So, my disclaimer tonight is that everything I'm saying is simply for educational purposes, right? This is only for educational purposes. This is not a substitute for individualized medical advice. So please make sure that you consult with your designated doctor before you make any healthcare decisions, okay? But let's learn more about fibroids because they're very common. So, how common are they? In the US, according to the NIH, the National Institute of Health, up to 70 to 80% of women in the US will be affected by fibroids. It's actually a lot by age 50. And, these days we're living longer by the grace of God. So, 70 to 80% of women, that means 7 to 8 out of 10 women by the time they get to 50 in the US, they would have dealt with fibroids at some point. Now, the other thing worth noting is that fibroids tend to be more common in Black women, 2 to 3 times more common, actually. They tend to be diagnosed earlier, they tend to be larger as well, and they tend to be more symptomatic. Now, I always love to speak from a public health lens because that is my background. And so I don't like statements that just end there saying, oh, this is the statistic. But it's always important to really address the socioeconomic roots, right? Or the socioeconomic factors contributing to a certain statistic, basically, that we're seeing, because nothing just happens by chance. And otherwise, it actually ends up sounding like a blanket statement, which is not good, in my humble opinion. It's just not good science, to be honest, because what it does is it unfortunately stereotypes a people. And I remember being in medical school and just being so over it. Every single diagnosis, oh, more common, oh, more common, oh, why? Let's talk about that. It otherwise can easily stereotype a demographic. So that's not good. Okay, so let's talk about what exactly fibroids are in the first place. So we've talked about the fact that they're very common. That's why we have to have this conversation. But what exactly are they? So, and the formal term for fibroids is uterine fibroids or leiomyomas. Leiomyomas, they are actually tumors. They are actually tumors. They are benign tumors. So in when you have a growth, a tumor is a growth, an overgrowth basically of cells or tissue. And so when you have a growth, it can either be benign, meaning it's non-cancerous, or it can be malignant, meaning it's cancerous. So although they are tumors, they're growths, they're not cancerous. They're benign tumors, so growths that happen to grow in the smooth muscle. So they're our bodies are our skin, right? If you between the skin and the blood, there are basically layers of skin, fat, etc., etc. So the layer that has the smooth muscle in the uterus, okay, is where these tumors tend to grow. They can grow inside that, they can start to grow into, they can project into the uterus. And the growth is influenced by actually a couple of different pathways. Hormones can contribute, like a hormonal imbalance can contribute to the growth of fibroids. Inflammation is a big driver of fibroids. And then there are also growth signaling pathways that can happen in a person's body, and that can contribute to that as well. So let's see. I want to talk a little bit more about the root causes and the socioeconomic drivers that tend to contribute to what we're seeing, right, with the increased burden or the increased prevalence that tends to happen in Black women. So it's important to identify. It doesn't mean that Black women are inferior at all. It doesn't mean that there's also inevitability. I remember I had read a post on social media, I think it was Thread. Someone had asked, do white women get fibroids? And actually, they do. It just is the prevalence for some reason, or the reporting, it just tends to be more commonly seen with Black women. And let's talk about why. I think this is important. Here are some of the factors that contribute to this. One of them is stress. Actually, exposure to chronic stress has been shown to activate cortisol, and it also activates inflammatory pathways in a person's body. This can be stress due to so many reasons. It could be familial, it could be relationship, it could be tied to one's race, it could even be tied to economics, right? Let's say there's financial strain. It can also be due to caregiving overload. So a state of chronic stress in a woman's body can contribute to the growth of fibroids. There are times when people they'll come and tell me like, "Doc, I was fine. I had no issues." And then it's like after, oh, I hadn't gone to the doctor in a year, and then my periods got so bad. Okay, why didn't you go to the doctor? I had so much going on. There were things in my family. This person died. Da da da. What is happening over that time is exposure to stress. elevated cortisol levels, elevated inflammatory markers. And what's happening in that time? I have to go back. My friend said, thank God Kava is healthy. We actually need to catch up, and we need to get Kava. Okay, sorry, back to the topic. So, yes, so chronic stress exposure is one of the biggest drivers of the growth of fibroids. Okay, now there can also be environmental toxins, and this is not talked about nearly enough. Okay, especially amongst African American or Black people. You could have a high exposure to endocrine disrupting chemicals. What are these? These are basically compounds. These are things in our day-to-day lives that have chemicals within them based on how they've been made that can then go and start to dysregulate your hormone levels. So remember that one of the things that can contribute to the growth of fibroids is this hormonal dysregulation. So when you have hormonal dysregulation that is being caused by chemicals, and what are some things that have them? Hair products, relaxers, texturizers, plastics, actually. Plastic containers, you know how we use Tupperware? Unfortunately, that contributes. And then you also have industrial pollutants. So, depending on the neighborhood you live in, depending on the city, depending on your proximity to even like an industrial plant, these things all contribute. And when you start to think of it, you're like, wow, you really have to think of your health very holistically, right? And so this is why we need to be aware. You want to use clean products, clean beauty products in general. Um, the other thing is a deficiency in nutrients. Sometimes there are food deserts. Poverty is associated with food deserts. And so let's say a woman now develops iron deficiency and she's having untreated heavy bleeding. Why is she having the bleeding? Because she has fibroids, and so now she's bleeding. She has the fibroids, and now she's also deficient in iron because of that. These things are all kind of tied together, and then there are also gaps in accessing healthcare. I've had patients come to see me and they've not seen a doctor in like 3 years, 5 years. So delayed diagnosis. And let's also talk globally, because we're not just talking about the US, but when you now take a global lens and look at this, delayed diagnosis is one of the most common issues that leads to bad complications, generally speaking, and also to premature death. People are not able to access a doctor. Either there's no time, the distance is too far, or there's a financial barrier that's preventing them from being able to access care. Sometimes people's symptoms are also dismissed, unfortunately. And then there are also times when women are not offered non-surgical management. And that's why I'm really glad we're having this conversation today, because it's true that surgery can help and it is necessary for some people. However, there are also non-surgical interventions that can be done for fibroids. So oftentimes, unfortunately, fibroids tend to be identified when they're pretty severe and not early enough when things could have been done to prevent them or reverse them, etc. Fibroids tend to cause heavy menstrual bleeding. That's probably the most common symptom that women will usually complain about. My periods are so heavy, and they're like literally life and death. Like for some people, it's really that bad. They can't get out of bed. They can't do anything. Some women even pass out. And why are they passing out? Because they're bleeding so much that they get anemic, and that can equally lead to fainting spells. Fibroids can also contribute to infertility, but this one has a big question mark next to it because it depends. There are different types of fibroids, and that depends on the location of the fibroids. I'm not going to go too in depth, but basically, if you think of the uterus like this, it's a canal, right? A baby is meant to sit there. So if there's a big mass sitting there, then it's going to prevent the growth of that baby, and that can lead to infertility. It can cause issues with conceiving in the first place, and it can also cause issues with miscarriages. So let's say conception does happen, the baby starts to grow, but there's that interference in the womb that can lead to it can prevent the growth of the baby. This can also lead to potential complications in pregnancy. So this is why, again, I always say the best time to prevent complications in pregnancy is before you even get pregnant in the first place. Okay. All right. Let's keep moving. So we've talked about how common fibroids are. We've talked about some of the root causes and some of the socioeconomic factors that tend to come into play when we're talking about fibroids. We've also talked about what they are. We've talked about the fact that they're benign tumors, so growths of the smooth muscle, and they're affected by multiple things: hormonal imbalance, inflammation, oxidative stress, which is frankly a stress response in your body, and then activation of growth factor. So unfortunately, fibroids are just a bit, for my liking, a bit too common in mainstream media. There are actually several women who have publicly talked about dealing with fibroids. Serena Williams, Lupita Nyong'o has been talking about this a lot recently. Tamara Mowry, Cynthia Bailey, Gabrielle Union. These are just a few. There are actually a lot more women who have been talking about fibroids. They've been dealing with heavy bleeding, fertility issues, and also having this issue with delayed diagnosis. I believe Lupita Nyong'o has been talking about that a lot. I don't know her full story, but in her case, from what I understand, her issue is she had been having these issues for quite some time, and the diagnosis just was not made. So this is not just a gynecologic issue, but it's very important to understand just how complex they are. Okay. So, as you know, one of the things we do at Rofi is wherever possible, we will encourage or educate you about functional foods. So, these functional foods are never meant to replace traditional clinical care, not at all. Conventional care, not at all. But they are good for you to know so that you can make a well-informed decision and you can supplement potentially after discussing with your doctor. So, one of the most common, in fact, the most common superfood we talk about at Rofi is moringa. And there are some studies. This is why I love moringa, because it's actually been researched. So there is some research that has been done. There was a study posted in the Journal of Ethnopharmacology, which showed that moringa leaf extract, it prevented the growth of uterine fibroid cells by about 40 to 70%. It depended, and that was influenced by how concentrated the leaf extract was and how long there was that exposure to the moringa. This is because it suppressed one of the growth pathways that was leading, inflammatory growth pathways that was leading to the growth of the fibroid. So this is actual research that has been done. Okay. Also, moringa has been shown to have anti-estrogenic properties and anti-inflammatory activity. This is key because we mentioned that hormonal imbalance is one of the things that can contribute to the growth of fibroids. And so when we reduce estrogen-driven cellular signaling, that's actually required for fibroids to grow. So when we take that away or at least reduce it with moringa, then it can help women as they're navigating this, of course, going through conventional medical treatment. And then the last study I'll mention is there are some animal studies that have shown that moringa reduces oxidative stress and inflammatory cytokines. In other words, moringa reduces inflammation in the body, and these are key contributors to the growth of fibroids, to the development of them in the first place, to the progression of them as well. That was a study posted in the Journal of Inflammation Research. So overall, the amazing thing with moringa is that it's not just targeting the symptoms. It's not just about it helps with anemia. And we've had a conversation about moringa and anemia, but it's more so the fact that it gets to the roots. It gets to the drivers of what is in actually causing the growth of the fibroids in the first place. Okay. So that is one thing that I want us to really know about we've touched on this a little bit, but for the sake of completeness, I am going to mention it again. Just three of the biggest risk factors for fibroids. The first would be hormonal dysregulation, as I mentioned. Having a predominance of estrogen and progesterone is what leads to this. So as I mentioned with the moringa study, when you have anti-estrogenic properties, that helps to now create a degree of regulation of these hormones. The second biggest risk factor is chronic inflammation and oxidative stress. So here, this involves stress physiology, metabolic dysfunction, and then exposure to toxins. So this is where the day-to-day issues of life, the stressors in our lives, and also the exposure to environmental factors, plays a key role here. And lastly, one of the biggest things we always have to think about with fibroids in today's day and age is the fact that there tends to be delayed diagnosis and untreated bleeding. And so anemia tends to be commonly associated with this, and that actually worsens the disease burden. What do I mean by that? Let's say you start having symptoms and you go see your doctor after a week or 2 weeks. That's a very different scenario from 6 months down the line or 6 years down the line, because these are growths, these are tumors. They're benign, but they are tumors. Remember that. So over time, what's happening is they are growing or potentially growing, especially if you don't know what to do to prevent them or reverse them, etc. Okay. So let's actually now segue to talk about prevention. And with this, it's really about reducing the potential risk of developing fibroids in the first place, right? So I'll just mention a few key points. Ideally, this is something which, once you identify you're having bleeding, you've been diagnosed, you should really go see your doctor and get formally evaluated. The key point I want you to know is that if this is something that runs in your family, if this is something that you've even had a personal history of already, this is important to know. And there's a very important point I want to make about fibroids. Fibroids can come back. They're growths. Even if people have surgery, they can come back. There's no guarantee that once you've had surgery, that's it. Okay. I think that's very important to know. And oftentimes that's not communicated often enough to people. You literally are encouraged to change your lifestyle around, actually. So, how do you prevent fibroids? If there's any degree of hormone imbalance, that should be addressed. And it's good because if you can check labs, for example, and identify, then you can start to try and create this state of hormonal balance before you even start having symptoms. You also want to try and live an anti-inflammatory lifestyle because that will help to reduce the inflammatory load on the body. How do you do that? How you eat, through regulating stress, and also through detoxing the body. Supporting the liver and the gut will also be important. Why? Because that is where estrogen tends to be metabolized. And if a woman has heavy bleeding or if there's a family history, always have it on your radar. Know that that's something you should look out for. So if you notice that your periods are getting heavier than normal, it's advisable to make sure you follow up. All right. And then make sure you find a doctor that you are comfortable with. That's very important. And I always tell my patients, I may not be the best doctor for every single person, but it's always important that you find someone who you're comfortable with and you can really open up and talk freely about your symptoms with, talk freely about any questions that you may have, because that is what's actually going to help you. I always say that the Latin word for doctor is teacher. And so as a doctor, by default, our job is actually to teach, to educate. That's really the premise of our job. Okay, so how can we reverse them? How can we manage them? It really depends. This is why following up with a doctor is important. You would need to get an ultrasound, most likely. You'd probably need some blood work as well. Depending on how big or how small it is, depending on your goals in life, if you desire to have children, if you're older, you're younger, that's going to be important. And then there are a lot of things that can be done with nutrition and lifestyle. And that's one of the biggest things we do in the work we're doing at Rofi to really help women learn how they can optimize their lifestyles so that they have non-surgical options available to them. Wherever appropriate, you could consider botanical or micronutrient support. But again, you need to first identify if there are issues, right? What are the micronutrient deficiencies, if any? And we talked about moringa already and how it could be helpful. Some people will require medical treatment, like you may need a procedure, you may need a surgery. And the default has been hysterectomies for a very long time. But these days, we've actually progressed a lot in medicine. So know that you have options, but it really depends on a case by case basis. So this is why it's good to get plugged in with a doctor you like, you're comfortable with. And sometimes we'll actually just say, let's wait and see. That wait and see period, at least at Rofi, doesn't really mean wait and see. It means let's really optimize your lifestyle and let's see how best we can use that, your lifestyle, to really help manage what you have going on. So at Rofi, let's talk about it. What are we doing? It's important we get to the root. We try and figure out what exactly is driving it, looking at it from a hormonal standpoint, an inflammatory standpoint, a metabolic standpoint, and also evaluating for anemia. We also encourage wherever applicable, right? Depending on the person's personalized protocol, moringa centered nutrition would be helpful, because not only does it help with things from an anemia standpoint, helps with inflammation, but as we've seen, as we've discussed, the research shows that it does help with targeting the growth pathways as well. Now, sometimes women can actually have fibroids when they're pregnant, and they can discover that the reason why they're anemic is because of fibroids. I love the work we're doing because it really becomes very personalized. And, if you're having heavy bleeding, you have goals to get pregnant, let's work together and let's actually see how we can optimize your health and your care to make sure that you're ready for the season, right, when it comes. So overall, I just really want you to take away a few things today. One, fibroids are benign tumors. They are not cancerous, but they are growths. They are tumors which tend to grow in the muscle of the uterus. Sometimes they can grow into the uterine cavity or the inside of the uterus, but not all the time. Fibroids can be managed. Sometimes surgery is needed, but not all the time. Sometimes we need to wait and see. An anti-inflammatory lifestyle can help, but sometimes it could be really helpful to get the necessary guidance to be able to know how to live that. If you've been having heavy bleeding, it would be advisable to make sure you connect with your doctor and make sure that you evaluate that further. Okay? I don't see any questions coming through. Oh, and lastly, fibroids can grow back. Even after people have had surgery, fibroids can grow back. So those are the key points I want you to really know for today. Those are the key points. And I don't see any questions. But thank you so much for tuning into today's live podcast recording. This was amazing. This was amazing. This was amazing. I trust that you learned at least one new thing today. And so, God willing, I'll see you back on the next episode. Oh, while I'm here, let's talk about a few things happening at Rofi. I'm just so excited because we have our fitness classes. Woo! 5 a.m. crew. We are back tomorrow, Friday. Today was a day off. We are back tomorrow. And we are going to be working out. We are going to be working out tomorrow. We're going to be working out. So 5 a.m. If you're looking for a community to work out, to recover after having a baby, if you're currently pregnant and you're looking to just optimize your health, learn how to prevent complications while you're pregnant, when you're looking to lose weight, please, Rofi is the place for you. Look no further. Okay? Literally, the goal is to have everything you need there. If you need meal prep services, we have meal prep services available. If you need moringa is available. We have the powder and we also have the capsule. I've also written several books, guys. I wrote a book about longevity, about how you can live beyond 100 years of age. And it's amazing because, in my humble opinion, it has the key. It's a very simple, I dare say, simple book. Like, you can read it in a day, to be honest, but it can change your life. I studied a lot of populations around the world, a lot of research that had been done on populations around the world that had lived long, and synthesized it all into a very easy to understand book. Okay. I also wrote the Cherishing Pregnancy book. And that book has weekly prayers, it has daily affirmations. It explains to you what is happening each week of your pregnancy. And it also gives you a guidebook on how to prepare your body so that you're preventing complications whilst you're pregnant and also when you're postpartum. So, there's a lot at Rofi. There's literally so much to explore. If you have any questions, you're always welcome to um, send in your questions. If you have a testimony, we love to celebrate the God in you. Send them in, send them in, send them in, please, so we can celebrate. Send them in. But I pray that that blessed you. I pray that that blessed you. I pray that that blessed you. Have a good evening. And I'm so honored that you chose to spend your evening with me. If you are listening to the replay, please comment and let me know one or two things that you learned from today's session. All right. Have a great day.